Stay where you are.
It's okay. Oh.
Just jolts inside.
Yes, so you've got a constant pain here, and under movement it'll shoot into your body.
Yep.
Okay.
Can I lie down or something?
Yes, you can lie down or sit down, you can do anything you want.
Easy, tiger. Easy. It's okay. Come on, brother. I love you too.
We won't tell anyone at school, that's okay.
No. Yes.
Okay. What would you do?
This is actually a really good way to assess an acute patient if you can get them into this position.
I can now feel a pain in my right thigh and my right groin.
Yes. You've got a problem with your pelvis, but you've also got a problem in this bone here. Is that tender there, like a bruise?
Yeah, a little bit like a bruise, yeah.
What about there?
Yeah, a bit more, yeah.
Okay, that's enough information.
Yeah.
We're just going to check the films. We've already examined him. He's got a problem with his right SI joint, there's no doubt, but there's also evidence that he's got a potential disc bulge at L5, and we need to see which is the primary. That sacrum's giving him a lot of trouble. So he's got two problems. That disc's the wrong shape. It's been there for a long time. He's lost a fair bit of disc height there, and it's actually quite parallel. This obturator's very, very open. So and you can see that the symphysis pubis has moved away from the side of subluxation. So it's external on that side. The whole posture of this lumbar spine definitely looks AS. He's lost a fair bit of the curve there. The sacral angle's very shallow. He's definitely got more than one problem. You've got two problems. You've got one problem in your pelvis, which is what I think started everything. Today, you've got the nerve irritation from that pelvic problem, and you've got some nerve irritation from a disc bulge that has come from it. Okay? That's why you're in so much trouble. Alright?
All the time, okay?
That's it, good, perfect. Alright, you were right there, Georgie. We were devastated when this happened. The camera timed out right at the wrong moment. We're going to show you the setup anyway. We just got him further into position, took the ilium to the sacrum and made a nice clean adjustment. What we'll do is we'll show you again later on the second visit.
Not fainting yet, you know?
No, doing well.
Now you're going to be quite surprised. Your first couple of steps will be a bit hard, but after that they'll get easier quite quickly. Alright? I want you to use my arms to help yourself get up.
Still hurts.
Yeah, that's why we've got to get you up. We've got to get some movement in there. That was easier, doesn't it?
It's easier.
Okay, I want you to walk down here by yourself. Cool. Try and get some movement in there.
Get there.
Any way you like.
We'll try and sit down maybe this time.
It'd be good if you could sit first.
I'll sit.
Yeah. But that's it. Now what you're probably finding at the moment is that even though you can move your legs freer underneath your body and you can get a bit more weight on them, that the other muscles are cramping up.
Oh yeah. That's...
When I get some pressure off this next one, some of that will back off. Okay? Bit like a bruise feeling?
Yeah, that's what it is, yeah.
Yeah. Okay. Okay, I'm not going to push on this too hard with my leg. It's all my hand doing the job. Now we're going to do what we did before. Come up sideways. Where'd that ice go? Okay. Put this ice in here. When you cough like that, did it shoot pain anywhere?
Yes, still does.
Yeah, that's the disc.
It's still in that spot there.
Yeah, that's alright.
The right hand side.
That's the disc. Now you'll be able to get more weight on your legs now.
Off for a walk again.
Yep. Come forward and then straight up.
Oh, really?
Surprising, isn't it? See how you can stand more relaxed?
Yeah.
Go for another walk. Have a look how better he's walking now. Come and have a look. See how he's got his body up above his pelvis,
much better.
and his legs are flowing through underneath his body. He'll still be in pain and he'll still get the cramping, but it's all starting now. His body can heal from that position. He came out of hospital to the practice. He was just like you.
Oh shit.
They wanted to carve me bloody back up. And I said, nah, I'm coming to see him.
He was alright. You can sit down again if you need a break.
No, I'm right.
We've just taken a lot of pressure off these nerves. A big bunch of pressure off these nerves.
Okay.
And you can see they go into the top of the hip, into your bottom, into the back of your hip joint on the other side. And they'll go right through your leg. When this nerve wakes up, it can swell. What you can expect right now is you can stand by yourself, you can move around, you can walk, you can get more weight in your legs. Your legs can move more freely, but you'll still have swelling in your nerves, so you'll still have pain. And the pain might even go to a different place. So don't panic if it happens like that.
Okay.
Alright? It's just these nerves waking up.
But it doesn't hurt now. It doesn't hurt here. It does hurt
That's
here.
what he's saying.
Because before,
Yeah.
every time I did this, it just had the jolt of pain
Yeah,
going towards the spine.
but that's gone now.
Okay.
Yeah.
Whew.
Well, mate,
Thank you.
nice to meet you, buddy.
Nice to meet you. Oh!
Okay, so this is about 5 or 6 hours later.
Looks good, doesn't it?
Much better than it was today.
Yeah.
Absolutely.
Thank God.
Yeah, it's looking good. Good. Excellent. So just the fact that you can sit and take weight through your lower back is a very good sign.
Big improvement.
Yeah, big improvement. And that joint there, that's the first correction we made. That's actually moving really well. And on top of moving well, there used to be a big puddle of fluid that sat over that joint, and we couldn't see that dimple as well as we could see this one, but now we're starting to see it again.
Okay.
So that means your body's already starting to get rid of some of that fluid. See how I can bring you back over my hand? We didn't actually get to sit you down because you couldn't sit, but if I'd have done that to you earlier, 5 or so hours ago, there's no way you would have tolerated your weight coming back. So everything that I'm seeing there tells me I've got to leave you alone a bit longer.
Okay.
It means your body have accepted what I've done, and it's still in a process of healing. So tomorrow afternoon we'll have another look. That's not bad. That's a good result. It was only a few hours ago that he was kneeling on the floor. So we're on the right track. Good on you, mate.
Okay.
Thanks for coming in.
3:15 tomorrow?
Yeah.
We'll be back.
24 hours exactly.
Since the first one, isn't it? 24 hours since the first one.
Yep.
Okay, I want you to stand up. Beautiful, very good. We didn't focus a lot on this on the first day because Jan was in too much trouble, but what we did observe was that his whole centre of gravity was off. At the moment his head's sitting right over his sacrum, his spine's very straight. We don't have a lot of guarding in these muscles at all. You'll probably find, Jan would probably find if he sat for a while and stood up, you'd get that pinpoint pain there a little bit still. Yep. But other than that, you don't have that really strong cramping pain or the pain down the leg. No. Good. Just going to check your whole spine. It's very good. Just going to move you side to side. And what we're looking for here is just making sure that the normal motion that should exist in these joints has returned, and the fluid that used to sit over the joint has continued to disappear, and it has, so that's good. Alright, you're actually in really good shape. I'm going to give it one more little adjustment just to kind of get you over the weekend, and then we'll follow it up on Monday.
Oh, okay.
Just to let you know, the people who saw part 1, this is the adjustment the camera missed. Exactly the same adjustment, we're just going to repeat it here. Straighten that leg out, that's it, and bend that leg. You're a bit more agile now.
Oh yeah. Yesterday I was a dead man walking.
Yeah.
Now I got my life back.
Okay, what we're repeating here is the very first correction that we made. Okay, that's in the right spot there. Just got to make sure, like yesterday, that we don't bend you or twist you. Just going to bring your whole body over a little bit. Let that bottom leg straighten right out. Just a quick technical note, I wasn't entirely happy with the weight on the shoulder for this adjustment. The adjustment did go very well though, it was very specific, very clean, and the rest of the spine wasn't affected. Ideally though, I would have let the shoulder come forward with the patient at the point of correction. Let your arm relax a little bit.
Oh.
Very good. Cool.
Much better than yesterday.
Much better than yesterday.
Doesn't hurt at all.
Good. Alright mate, I want you to come up slowly. Very good. When you're ready, just stand up and have a little walk. Get some movement in there. This is a blessing in disguise because it's made you come in and get this stuff fixed, and you'll find that, you know, over the next couple of weeks and definitely months, your body will actually get better and better and better to the point where you were way better than you were even before you had the injury.
That's good. That's good. It's positive then.
Yeah.
That's good. That's
Good on
good.
you, mate.
Okay. That's it?
That's it.
Okay.